Hi everyone, and welcome back to our podcast. I know you are all aware that we're going to be having a special guest on our episode today, and so this edition is going to be a very special one. I know you know me as Sinat, the Educative Urology Nurse Practitioner, and we have with us here today Mr. Umar, who is a male fertility specialist, and he has written a book which is one of the best-selling book now on male fertility. Please, can you introduce yourself to the house?
All right, so my name is Godwin Umar. I'm a nurse by profession, and then I'm a male fertility health advocate.
So the topic we are going to be discussing today is male fertility, prostate cells, and what every man needs to know about this. So my number one question I'm going to be asking you today is, why is male fertility, what is male fertility really about? And why is it that there is not enough awareness about this?
Okay, let's put it this way. What does it really mean for a man to be fertile? So male fertility is the ability of the man to contribute to conception or pregnancy. It simply means the man's ability to play his role or his part in achieving a pregnancy. So now, what is actually the man's role? I bet you that some people believe that the man's role is being able to, have sexual intimacy with the partner. Of course, it's way more than that. So the man's role is his ability to produce and deliver healthy sperm to the woman's reproductive system.
For conception.
And then, when the way say sperms are healthy, so healthy sperm, they are sperm that are adequate in numbers. That is talking about the sperm count. The sperms that have the right shape and structure, that is talking about the morphology, and then they move effectively, that is motility of the sperm. So when a man is not able to perform this role, now we're talking about male infertility. And WHO stated that male infertility is the inability of a man to cause pregnancy in a fertile woman after 12 months of regular unprotected sexual intercourse. It means that for a man not to be able to cause pregnancy in a fertile woman, so a woman is believed to be fertile, certified fertile, and then there's a man.
So they was having sex for 12 months, and the woman is fertile.
Yeah, there's a reason for that 12 months, because sometimes even couple who are perfectly okay, both of them are fine in terms of their fertility, they still require several cycles before they get pregnant. So WHO have also further stated that 20% of infertility cases are down to the male factor. And then another 20% down to the women factor. There is 30% of combined factor, which means that the man and the woman they both
combined
have some
efforts.
problems.
Yes.
And then also there is 30% that is unexplained. It's just maybe they are not doing the right thing or something is not,
right.
adding up. So the problem now is that, having this statistic, some people still don't believe that male factors are responsible for infertility.
Because the society has made us believe that most times women are the problem.
So they believe that, all of the problem is still down to women. Or they believe that, okay, even if there is a problem with the men, they are not as significant as we portray it to be. So, and then that is a problem. So why is that? Why is there such perception or low awareness? Well, the first issue, I would say, from my interaction with people and from my own personal research, is that there is simply lack of knowledge. People
lack of awareness.
They just don't know.
Yes.
I've done a kind of poll on my page asking for how many percentage of infertility are down to men. A lot of people went for lower numbers because they just don't know.
They don't believe. They don't believe.
A very important part of that is also our culture and society, then religion, that we're all brought up in. They all believe that women are the problem. The culture thought so, the religious thought so. You go to churches and you hear pastor, you go to mosque here, imam, they say if you're a woman, you're looking for a child, come out for prayer.
They even do vigils for women.
Exactly.
They say trying to conceive women. They do vigils for them, and nobody involve men in this in these prayer sections.
Exactly.
It's just like they're stereotyping women as infertile. That's why I just see that as.
So that is the way it is. The society thought that, and then to shock you, see that even the women themselves, they think they are the problem.
Because that's what the society make them to believe. If you don't have a child, nobody will actually talk to the husband. The first thing everybody will be talking about is, what are you people doing? It's the wife.
Yeah. So you hear them say, it pains me, I can't give a child to my husband. They just believe that they are the problem. And then another reason why this perception is that is because of the stigma. So most men, they translate fertility to mean sexual performance. So they believe that the only people who are infertile, they are impotent people, and then that is not true. So all of this, what all of this do is that it create or put all the burden on the women, and then it also delay conception
Sexual.
because
Because
if
it
they
affects
don't
them
get
psychologically. Because imagine people just start thinking you're the problem and you
Yeah.
might not be the problem.
So-
and that affects women psychologically.
so that's where we are.
Okay, so when we look at male fertility, what people don't know is prostate is also involved in male fertility.
Exactly.
Because the sperm actually is the fluid that carries the sperm. 30% of that fluid is produced by the prostate. So even if you have good motility of your sperm, that is, your sperm is moving well, it's moving fast as it should move. But if you don't have a good prostate health, if your prostate is not producing enough fluid to carry this sperm, to deliver the sperm for conception, fertility might not occur as well.
Exactly.
So because people believe that when you talk about prostate, it's mainly for older people. Why would you say prostate? Why do you want to discuss prostate health with younger men? But what they don't know that prostate plays an important role in fertility. Testis does not do the work alone. The work of fertility works both with the prostate and the testis, because the testis produce the sperm and the prostate houses the two sacs that help to produce the fluid that carries this sperm to deliver it for conception.
Correct. Yeah.
So thank you for showing more light on that.
That's all right.
And another question, because we've sent messages, people have been sending their questions in when we started creating awareness about this episode. And that question that people sent that I would want us to discuss today is, what really causes male fertility? What are the causes of male fertility?
Okay, well, on that, I would say there are about 3 main causes. So the first one is problems with sperm production, and then another one is problem with sperm delivery, and then there's also genetic factor. So the first one, which is problems with sperm productions, the testicles is charged with the task of producing millions of cells every day. So sometimes something interferes with this process, which is a very vital process. And when that happens, it either means the sperm is not produced in adequate number. Talking about the sperm count.
Yes.
Yeah. And then WHO have stated that the normal sperm count is about 39 million or above. So if it's less than that, that's low sperm count. So it can also mean that the men produce sperm that are not moving well, talking about the motility, or that do not have the right shape or structure. That is the morphology. So the WHO also stated that the normal morphology is 4% or more. So if it's less, then the morphology is low. So there is also some cases where some men do not produce sperm at all. And in medical terms, we call that
azoospermia.
Yeah. So what actually interferes with this sperm production? There's one common one called varicosis, quite common. So varicosis is an enlarged vein around the testicles. So it just disrupts the normal environment needed for sperm production. There is, undistended testicle, there is testicular trauma, any kind of accident.
And that is why this issue of undistended testicles, when you have kids, try to check their testicular sac. Know that their testicles are distended, because this starts most time from childhood. When you have a male child, look at the testicular sac, look at the scrotum, ensure that the testicles are distended, because it takes a while for the testicles to distend into the scrotum. But when you as parents have a look and see, this is actually not the way it's supposed to, the sac looks empty, then you can seek medical intervention early and save that child fertility from fertility problems in the future.
Yeah, so it's easier to correct when they are
younger. Yes.
Yeah. So that is one. Then another problems that could occur from there is problems with infection, like inflammation, like prostatitis. That is inflammation of the
prostate. Yes.
That is where it also comes in. So all of that can interrupt with sperm production. Now, coming back to the second cause, which is problem with sperm delivery. So in this situation now, the sperm is produced absolutely fine, but there is a problem getting it to where it's needed. So why is that so? Because the sperm needs to travel through a long track of reproductive system. So along the way, there could be a blockage. That is one. There could be, undescended testicle that we have talked about. There could be, infection or prostatitis. All of that can cause problem with passing the sperm to where it's needed. And then another one is what we call erectile dysfunction. So in this situation now, the man produces sperm that are adequate, that are healthy, but is not able to achieve erection to even have sexual intimacy before the sperm are even released. So that is one. Then the last cause of male infertility is genetics. So sometimes the problem is not something the man has done over time.
Something he has power over.
Yeah,
it's just genetics.
It's genetics. So abnormality with the gene can cause problem with the sperm itself or even how the sperm function. The one important thing to note is that in most cases of infertility, the one I've seen, they are caused by a combination of factors rather than just one
factor.
And then the first thing to do, in coming out of it is doing the right testing and know where the problem is. Yeah.
Yes, like you said. So like most men don't know that problem with prostate can cause fertility. Like there's something we call prostatitis, what's the inflammation of the prostate. When people hear about prostate, oh, it's an old man's disease. Yeah. Don't talk to me, I'm still young. But what you don't know is that prostatitis is the silent killer of male fertility. Because it mimics symptoms as just urinary tract infection, and whereas it's an inflammation of the prostate. And what is actually significant about prostatitis is you also have your PSA raised. So, and there are three things that will cause your PSA to be raised: either infection, enlarged prostate, or prostate cancer. But when it's prostatitis and it is detected early, it can be treated, thus preventing it from causing fertility issues for you in future. So it's just like what Mr. Umar said. It's a combined factor.
Yes.
So we don't just look at the testes alone. We don't look at the testicles alone. We don't look at the testes alone. We don't look at the sperm motility alone. We also look at the prostate health. Look at the genetics and look at this all together as a combined factor that would cause infertility in men. Thank you so much for showing so much insight into that last question. And another question that came in to our inbox and people would love an answer to is, how can a man know if he's experiencing infertility? Is it that he will not have erection? It's because I got someone message me recently and said he has not been having early morning erection recently. Does that mean that he has infertility?
So again, there is usually no physical symptoms, apart from the fact that some men are not able to cause conception. So the only way to know is through fertility tests. And then the chief of them, the number one of them, is semen analysis. This is usually recommended or requested by most physicians. So what do they look for in semen analysis? So semen analysis analyzes, number one, how many sperm cells are there? That is talking about the sperm count that we have talked about. How well are they moving? Motility. What are their shapes and structures? So talking about the morphology again, and then the volume of the semen. So that is one. So information from there can tell us, can guide us in the right direction. And then another one is hormonal testing. If there's any maybe there's a problem with the hormone or it's been suspected, they can check the blood for prolactin, testosterone, FSH, follicle stimulating hormone, yes, and then the luteinizing hormone as well. Even sometimes they do thyroid test. All of that can reveal some information about your fertility. And also there is another one called physical examination. The physician have a look on the testes, the structures, to detect any blockage or abnormality that we have talked about, any varicose vein, any problem with the prostate. That can be detected by just checking the prostate and the testicles. Then, if the problem cannot be detected from all of these tests, they can proceed further to imaging and ultrasound. So imaging also looking to see if there's any of this blockage or structural problem. And then also, they can also do genetic testing in case of genetic involvement. And then there's one important one that they do sometimes. They call it post-ejaculatory urine sample testing. Because in the course of infertility, there could be problem with ejaculation.
That's retrograde ejaculation.
Correct.
That goes back into the bladder.
Instead of the sperm coming out forward through the penis, it's
going back.
The bladder.
Yes.
And what they do here is, after sexual activity, a sample of the urine is taken and it's been tested for presence of sperm.
Sperm.
And if there's sperm, then that means that is where the problem is. So all of these tests done to know where the problem is. And then also, it's also worth noting that in most cases, most patients don't need all of them. As I said before, you need to start from the top and then keep coming until the problem is found. Yeah.
And there are some medications that men take that treats enlarged prostate that could actually cause retrograde ejaculation.
Yeah.
There is a medication that helps to shrink the prostate.
Yeah.
And this medication, one of the side effects is causing retrograde ejaculation. And also some medications such as alpha blockers.
Yeah.
These medications act as they act on the smooth muscles of the blood vessels,
Yeah.
and when they relax blood vessels, yes,
erection problem.
they cause erection problems.
Yeah.
So it's just balancing things here and there, because you are trying to treat the prostate and you are also trying not to cause fertility problems for the person.
Yeah.
So that's what most times when men that are quite young are seeking for prostate surgeries or prostate measures to treat their prostate, maybe they've got an enlarged prostate, we ask them if they have completed their family cycle.
Yeah.
If not, then we actually start talking about other options.
Yeah.
Maybe like sperm freezing, IVF options and everything.
Yeah.
So thank you for showing so much insight into that last discussion. And the next question I'm going to be asking, as one of the questions we have received and people would love to get answered today too, is what treatment options are available for men having male infertility? What are the treatment options people could actually look into? Okay, you've been diagnosed to have male infertility.
Okay.
That is not the end of life. So what is the next option? What can people do? How can people conceive even after being diagnosed of having infertility as a man?
Well, that's a good one. So, first of all, again, I would say there is no one size fit all in terms of the treatment.
Yeah.
So, what happens usually is that your doctor or your physician have all the information at hand. I mean, your fertility testing and all of that. And then he's going to base the treatment based on several things. Factors relating to your partner's fertility health. What are your goals? What do you want? And how severe are your symptoms? And do you have any comorbidity, that is other diseases or other conditions?
So
once all those informations are available, once all this information is available, then the first thing is that there are different options of treatment. You will go from the first option, which is, okay, can we fix this naturally? Is this something we can say, okay, adjust your lifestyle, modify your lifestyle, stop drinking or reduce alcohol intake, because alcohol interferes with the sperm DNA, or quit smoking? Can you do that? Can we?
Someone that has infection of the prostate and needs that side treated as well.
Yeah, so correct. If there's any infection, can we say, okay, let's recommend some antibiotics? If there's any need for any lifestyle changes, sleeping well and all of that. So if that does not work, that brings us to the second option of treatment, which is medication. Okay. So in this case now, okay, we look at your hormonal test, and if there's any problem, can we correct it with medication? Sometimes they give testosterone, or do we need supplement, or as I said before, do we need to give antibiotics for infection? That is talking about medication. And then if that doesn't still help, we come to the third option, which is surgery. Okay. So we talked about blockage, we talked about varicose initially. So surgery now comes in to correct all these problems. And then in most cases, especially in terms of varicose, once the surgery is done, then conception happens. Okay. And then also, if there's a problem with prostate, there could be minor surgery to correct that. So if all of these three options don't work, there's a fourth option, which is ART. It's called ART is assistive reproductive technique. So the commonest of that is IVF, in vitro fertilization. Yes. So there are basically 6 steps in IVF. The first one is stimulating the woman to produce
eggs
through some injection.
Yes, for fertilization.
Yes. Once that has happened, the next step is taking the egg out, and then the third step is taking some sperm cell out of the man, and then fertilizing it outside of the body in the tube, done by the specialist. So once that happens, the embryo is placed back in the woman's womb. That is the 5th stage.
Step.
And then the last one would be pregnancy.
Yeah, insemination back into.
Yes. So, well, IVF is a whole topic on its own. It's something we can't cover.
No, definitely.
Because there are mental aspect, there are emotional aspect, because
psychological even aspects, because I know women have lots of problems taking all these medications that help egg production that could be taken for fertilization. And I've not gone through IVF, but I have people around me that have been through IVF, and they've talked about the psychological stress that each cycle of this IVF gives them.
Yeah, because in most cases they require more than one cycle. And it's kind of loop, expectation, it doesn't happen and having to do it again. So it's a whole lot of stuff.
And even the financial aspect as well. It's in this part of the world we live in at the moment. I learned for you to do IVF now in the United Kingdom, you're talking about 8,000 to 10,000 pounds. That's a lot of money.
Yeah, that's a lot. Yeah.
So thank you so much, Mr. Umar, for throwing more light on that question. So the next question I'm going to be asking is, what advice would you give to couples going through this journey of expecting, trying to conceive, and they've tried, like you said, what we call infertility is active sex for 12 months with a healthy woman and without any conception. The woman has been tested that she's fine, she doesn't have any fertility problems, and they've been having constant sex. It's not haphazardly. It's not one sex once in 2 months or once in 5 months. No, constant sex for 1 year. That's 12 months, and there is no conception. What advice do you want to give to such couples?
Okay, well, couple undergoing the journey of TTC, that is trying to conceive. The first thing I would say is that, number one, do not self-blame. Because there's always tendency for that to think that, if I had done this when I was growing up or something like that. Do not self-blame. Trying to conceive journey is just a part of your journey in life. It doesn't define you who you are. It doesn't, take anything from you. And then secondly, I would say fertility journey is a shared journey. Do not try to, take the burden
on one partner.
Yeah, so you need to create a support group with your partner, number one. Because I know some men as well, once they find out that they are trying to conceive, they just
lock up.
So something like that. And sometimes
some of them start to go outside and start trying, whereas there might be a problem.
So that is one aspect. It's a shared journey. Create a support group with your spouse, with trusted friends and family, with your healthcare provider, and then number three, I would say protect your emotional space. So this is coming from someone to myself and my wife had to try for a couple of months. So within that month, I know the kind of call that come from home. It always mostly ended up in children when something like that. So you have to protect your emotional space. Decide what you are willing to share and to whom you are willing to share them. And then once you decide, lock it up.
I have someone, a couple close to me, who had similar problem. It took them a while for them to have their first child, their first pregnancy. And guess what? The first child they had, the wife got pregnant while they were on holiday. The wife didn't even know she was pregnant because the husband just said, enough of this, let's just take time out. They went on vacation, they went on holiday. She came back and she just got to know that she was pregnant. Because stress has a way of just trying, that psychological stress of you self-blaming yourself, you putting that burden of trying to conceive on yourself can also affect the fertility journey. So it should be a shared burden between partners, and partners should also try to stay away from people that are trying to make this process difficult for them. And also, I think I was happy when I discovered that you launched your book in church, because that is one of a primary community for us, because everyone is attached to a religious group, either church, either in a mosque, either even if it's the third religion. Everyone is attached to a religious group. And when the church is aware that this burden should not be put on only women, it is a shared journey between a man and a woman. They would also include men in activities such as we are trying to maybe pray for conceiving couples, not the women alone. And I'm even happy now. I heard some church are now doing male fertility tests even before marriage, which is actually very good.
I like that. I subscribe to that.
Yes.
Perfect. As far as they consent to that, that is good.
Because the truth is, some men even know. Some people, some not even only men. Some people know that they have fertility problems before marriage and they hide it.
Yeah.
So I consent to churches trying to do fertility tests for both couples, both men and women, before marriage.
Yeah.
Because this prevents people that are hiding and trying to cover up with religion and not opening up to their partners before marriage.
Yeah, so sorry, still on the advice for people trying to conceive. Another thing I would say is that, you are a whole lot of person before this journey.
Yes.
You have your passion, you have your career, you have your goals. Focus on them while you're waiting. So do not put everything on hold because you are trying to conceive. So focus on that, and then lastly,
live life.
Yes,
Just live life.
Live your life.
Live
your
it.
life. Yeah. So lastly, have the right information. And make sure
Speak to the right people.
That alone give you the confidence. As far as you're doing the right thing, all you have to do is wait it out, and it's going to happen.
Thank you so much for that insightful talk.
Yeah.
The next question I'm going to be asking on this episode is, can a man express infertility, even after having children?
Oh, absolutely. Yeah. So that is called secondary infertility. It means that this man is able to father a child or cause pregnancy before, but now is unable to cause pregnancy after 12 months of regular unprotected sexual intercourse. So what happens most likely is that, like I said before, sometimes this person or this kind of people might have fertility problem before, but not as severe or not as enough to cause
infertility.
So, for instance, the man has low sperm count. Maybe we said the normal is 39 million or above. If someone has 30 or has 20, it's still enough. Might just require more cycle. Or a man has sperms that have poor structure. Poor morphology. Like, I said the normal is 4% or above. If it's less, like 2%, it's still enough. Might just take more cycle. So in that case now, this man is able to cause pregnancy before. But now the situation might have gotten worse or even remain the same, but luck is no longer on his side like before. Now we're talking about secondary infertility. And then also the treatment for that is just the same as we have discussed before for the primary infertility.
And also another thing that can cause secondary infertility is, for example, as men grow older, their prostates also age.
That comes in.
So when a man has prostate problems and they get treatment for this, maybe through medications or through surgeries, and they have not ended, they still want to have more kids. Yes. So I think people should try to have this discussion and say, yes, before any treatment is made, whatever treatment you want to, whether you want to take medications that shrink the prostate, or you want to take medication that's relaxing the smooth muscle of the prostate, or you want to go to surgical interventions for an enlarged prostate, you need to talk about if you have completed your family cycle or you still want to have more kids, then that's what we talk about freezing the sperm, and at least that is actually readily available if after the surgery, because even after surgery now we do the robotic surgery now here in the UK, which they are able to spare nerves. But even if they spare the nerves, the sac that produces the fluid that transports sperm for fertilization unfortunately it's very close to the prostate. So as soon as the prostate is taken out, that is impossible. People have ejaculation, but they have dry ejaculation because the fluid that carries the sperm for fertilization is attached to the prostate, and as soon as the prostate is out, the fertilization cannot occur. So anyone that has a prostate problem and want to get it treated and is yet to complete their family cycle should think about options such as freezing their sperm before the procedure.
Yeah, that's correct.
All right, thank you so much. People don't know that fertility is so much related to prostate. When you talk about prostate, people start talking, I'm still young, why are you telling me about prostate? Prostate is very important. Prostate is a silent killer of fertility that people don't know. So let's continue our questions. So diving into testosterone replacement therapy, because I think a lot of people are on it now at the moment. And what do you have to say about the testosterone, the TRT, the testosterone replacement therapy?
Well, I know some men, almost men, they take it actually for bodybuilding.
Yes.
People who are into kind of sports, different kind of things, so they use it for bodybuilding. But what it does actually to fertility is that it switched off the body's own system So therefore, switching off sperm production.
Yes.
So I mean, in actual sense, they are improving their masculinity.
But they are reducing their fertility the options. So can you hear that?
So it's one way up, one way down.
One way down.
So that is how it comes in.
So yes, so if you are one of the people that are taking supplementary testosterone to improve your masculinity, you might be joking and playing with your fertility, man. So please watch it. And don't just abuse medications without prescription. Yeah. Because if you are taking supplementary testosterone, you need to keep checking your testosterone level, because your body knows the amount of testosterone your body needs to produce a healthy sperm. Yeah. And when you shut down that part of the body that controls that, to start giving it supplementary testosterone, and you're not giving it enough to produce the sperm that is needed to fertilize, then you're joking with your fertility, man.
That's correct.
Yeah, so thank you very much. So now let's dive into your book.
Okay.
So in your book, you talked about lifestyle interventions in managing fertility. Can you mention few about that for us? So if you want to know more about this, please go online. This book is selling fast on Amazon. You can get the Kindle edition, and you can get the paper copy to read, and you can buy it as a gift for men around you. Yeah. The title of the book is Why It Is Not Just Her. So it is not just her, it could be you. So please, the link to the book will be down below in the comments. Click on the link, go to Amazon and get a copy of the book to familiarize yourself with what you need to know about male fertility. Because he will be talking just briefly about what you need to adjust for your lifestyle to help with your male fertility, but you will not have the full course of the meal. So if you want to get the full course of the meal, go to Amazon and get a copy of the book for yourself. Yeah. Over to you, sir.
Okay, so again, I'll start by saying that, as we have said before, fertility is not just when you are in the marriage or when you are trying to conceive. It starts long way before that. So the lifestyle changes, everything you need to do is not just for people who are trying to conceive. As far as a man, you need to inculcate some lifestyle modification. So let's start with what we take in, that is nutrition and diet. So the body needs adequate, healthy nutrition to properly produce sperm. And then there are some important minerals or elements. First is zinc.
Zinc, very important.
There is also
lycopene.
Yes, vitamin D. There is zinc. There is omega-3. So zinc, what it does, it helps to promote sperm production and regulate testosterone. Yeah, there are some food that are very rich in zinc. Food like nuts, like walnuts, they are very good in zinc.
And even tomatoes.
Yes.
Cooked tomatoes.
Yes.
That's your jollof rice. And that buka stew that you're trying to avoid is rich in lycopene and is rich in zinc. And this helps with both sperm production and prostate health.
Yes. So also we have a vitamin D, which is very important in hormone regulation. And we know hormones, they are very important in terms of sperm production. So vitamin D can be gotten from the sun, which we all know. Just 20-30 minutes a day exposure to sun give you a very good vitamin D. Also, egg yolk is a very good source. And then omega-3, what it does is that it helps the motility of the sperm. It's very important, and it also promotes sperm structure, promoted from damage. A very good source is salmon and sardines, all those kind of foods. Then, and then a lot, those kind of minerals can also come in the form of supplements, like Wellman supplement. I used it before myself and it worked very well. Then also the zinc can come in the form of supplement. There are many supplements. They are in the book. Another one to think about is physical activities and weight management. So for a man, whether married or unmarried, looking to have children or not yet, you need to make sure you have the regular
healthy living.
Yes.
Inculcate healthy living.
Exercise well. Don't just stay at home.
Sedentary lifestyle.
Yeah.
Avoid sedentary lifestyle.
Not too much, not too low. Because when it's too much now, it's just like talking about the testosterone. You're building your body. So too much of it can actually work against your fertility.
Do you know, I was also telling people in my clinic recently that when you engage yourself in rigorous activities before doing your PSA test, it just gives you a false reading of an increased PSA, whereas it's not as if you have an infection, you don't have prostate cancer, you don't have a large prostate, but because you have engaged in a rigorous activity before doing that test, that just gives us a false reading of a raised PSA.
Yeah.
So we just have to do everything in modality.
That's correct. So and then number of weight management. If you are too overweight as a man or underweight as a man, it can affect your fertility. So you just need to work on the weight. That is very important. And then another aspect of what to do, the kind of lifestyle, is temperature, heat management. So
I was about to ask that question.
Let me tell you this: for all male animal I know, including even the human male animal, when God created them, so what He does is that He places the testicles outside of the body. Why? Because the testicles need cooler temperature, and way cooler than the normal body temperature. And by statistics, 2 degrees Celsius to 4 degrees Celsius lower than the body temperature to have optimal sperm production. So that is why the testicle is outside, to receive fresh air, to be cool. But what most of us men, what we do is that we now reverse this by either wearing tight clothing, tight underwears, or we put laptop on our laps, or we bath hot water, hot
tubs, jacuzzi,
all of that. So they all work against fertility. So we need to work on that.
So allow the balls to roll freely.
Let it
free. Allow it to breathe.
So that is how it should be. Just wear loose underwear. I was once a victim, but now I know better.
So you know better now.
Yeah. So then another important thing is also alcoholism and smoking. They both interfere with the sperm DNA, and it's dangerous. So the rule is quit smoking, reduce alcohol. If you cannot stop alcohol, just reduce the intake.
People don't even know that smoking contributes to kidney problem and bladder and even bladder cancer.
Yeah.
If we are screening you for bladder cancer, one of the questions we ask you is do you smoke? Yeah. And so people don't, the nicotine that you inhale while smoking does a lot of harm to your body than good.
Yeah.
So healthy living, when people are telling you to have healthy living, it's not only for it helps generally all parts of your body.
On that part, I used to tell people that, even if you don't have fertility problem, if you do all of this, it's not just for your fertility.
Yes.
It's for your
general well-being.
Overall health. Yeah. And then on that one too, lastly I would say, make sure you have adequate sleep. I know it's a difficult task to ask anybody. So
we're all working to make money. We're all picking shifts.
The sperm production needs that time of resting, that period of rest, where the hormones, everything work perfectly. So I would say, if you have control over it, aim between 7 to 9 hours of sleep daily. It could be at night, it could be during the day, but at least 7 to 9 hours
of sleep.
Yeah.
All right. On the last question, do you give consultation? What is the current cost of, if someone wants to say, now I want to come and see you, sir, I want to come for consultation?
Yeah.
What is the cost of the consultation for someone to come and have a consultation with you?
Okay. So for now, at the moment it might change later. For now, you just need to buy a copy of my book. Once you can say, okay, I bought the copy either from me or from Amazon, you are free to see me. So, and the book has...
that's the key. I'm just telling you, look at the key. You've gotten the key in your hands.
So, the book, as my friend has likely said, is on Amazon now, both physical and hard copy. Sorry, both hard copy and soft copy. And also I have copies with me at home. You can get it from me. So the book, it contains all of this information that we have shared and a lot more.
A lot more. So what we just discussed today is just the tip of the iceberg.
Yeah.
If you want to know more about what we have talked today, grab a copy of that book. Yeah. Because that is the price to pay for that consultation. So it's the copy of the book.
Once you get that, the book has 90 days fertility plan.
Wow. 90 days fertility plan.
Within 90 days.
Just fire, continue to fire.
And then what to do if you are trying to conceive, like we have said before.
Yeah.
And what the consultation involves, it will be to guide you on the kind of lifestyle. I have extensively researched it and I have practiced it myself. It's worked for me.
All right.
Yeah, I'm not lying to you. So I'll guide you on that, and then I'll also tell you what kind of medical help you need to seek. So that is what the consultation involves. All
right. It was a lovely and insightful discussion with you today, Mr. Umar. Thank you so much for coming to our podcast. And to our viewers, I know you've learned a lot today, and you know that you need to work on a lot of things. The major thing I'll talk about today is lifestyle management, because it plays a key role, even apart from male fertility, it plays a key role in your general well-being. As either a man or a woman, lifestyle management is very important. Diet, weight, general well-being altogether. it should be taken serious.
Yeah.
So we hope if we invite you to come back to us and discuss more on male fertility next time, you would answer the call.
Well, it's my second job.
That is amazing.
Yeah.
And to my men in the house, fertility problems does not only involve the testes. Prostate is also involved in fertility. So as you are checking for your sperm motility, your sperm your sperm count, you should also look after your prostate health, because both work hand in hand to help in fertilization and conception. And don't forget, fertility is a shared journey. The burden should not be placed on one part, on women alone or on the men alone, on one person. You as a partners should share the journey together. And I believe that working together, you would be able to achieve more. So thank you for watching our episode today. And if you have more questions, drop your questions in the comment section, or you can send a message, an email to me on oneinfoproject@gmail.com. Thank you for watching, and see you on our next episode. Bye.
Thank you.